The topic is Chapter 6, Documentation and Reporting. Module, report other variables that might affect the client. Variables that might affect the client. Illness. Client may have short-term or long-term illness. Sessions may need to be canceled or modified as dictated by the supervisor. RBTs must acknowledge illness and cancellation variables on data and graphs. Medication. Client may have medication changes that affect skill acquisition and behavior reduction. RBTs do not administer medication to client. RBTs must acknowledge medication change dates on graph and data. Sleep. A sizable percentage of individuals with ASD present atypical sleeping patterns. RBTs should acknowledge any sleep disturbances reported by parents, caregivers from night before session on data and graphs. Relocation. Transitioning from homes or towns can be large variables for clients to incorporate. RBTs must acknowledge relocation dates on data and graphs. Mental health. Studies within the last decade reveal rates between 67% and 70.8% of individuals with ASD who meet criteria for an additional mental health disorder described within the Diagnostic and Statistical Manual of Mental Disorder. RBTs must take accurate, observable notes, recording observed presentations and/or comments parents or caregivers or clients make, and communicate immediately following a session to the supervisor. Siblings. Siblings may be present during a session with a client. They may want to play and join the session. The treatment plan and/or behavior intervention plan may cover this scenario. Reference to both is recommended. RBTs must take accurate, observable notes, recording observations, and communicate immediately following a session to the supervisor for supervision. Other variables. There are many varied possible variables that RBTs may come into contact to in a session that may affect the client. Always communicate any instances of variables that may affect the client to the supervisor as immediately after the session as possible for guidance and supervision. Intro to topic. Chapter 6, Documentation and Reporting. Module, generate objective session notes by describing what occurred during sessions. A session note should include the following: objective information, behavioral information, be descriptive of behaviors observed, incident report information if occurred. A session note should not include the following: mentalistic descriptions or explanations, suggestions of treatment planning, suggestions of skills training, suggestions of effectiveness or ineffectiveness of behavior intervention plan, or subjective information. An example of an appropriate session note: today was a good day. Worked towards skill acquisition goals. The RBT then would list a few. Client is making consistent progress. Also mastered current level and will be increasing requirement to, RBT would put in that requirement, once mastered. Another example of an appropriate session note: today was a rough day. Client started school. Behaviors targeted for reduction were at a higher level today as compared to the past couple of sessions. Made appropriate changes to treatment as outlined in treatment plan. The RBT would look at the setting factor information on the top of the data sheets and record. The note will go on to account for increase in setting factors and proactively decrease probability from maladaptive behaviors, decreased task requirements, and increased rate of reinforcement. And yet another example of an appropriate session note. Implemented new treatment goal today. The RBT would list the goal. Resulted in an increase in maladaptive behaviors. However, proactive and reactive strategies, as outlined in the treatment plan, were effective at reducing the behaviors as the session continued. A few more examples of session notes. Focused on, the RBT would then list a skill or program. Client responded well. Currently, client is, and the RBT would describe the level of functioning on the program. Implemented new teaching strategy today. The RBT would outline what that was, possibly social story, role play, modeling, or video modeling. Client had a hard time engaging, but once engaged, strategy seemed effective. Another great example of a session note. Increased task requirements for. The RBT would then list the skill goal. To next level as client mastered current level on, and put in the date. Increase in maladaptive behaviors. However, this is expected with increased requirements. And the RBT can list, such as refusal, latency, or verbal aggression. Here's an example of a great session note that includes an incident report. Incident today. The RBT then would describe the major details of the incident. For example, the client displayed unsafe and dangerous behaviors, including threatening harm to self or others, and attempted harm by aggressing towards, and they would list the person or persons. Displaying aggressive behaviors including, the RBT would include specific objective behaviors. For example, biting, kicking, stabbing, or hitting. Implemented crisis intervention, and the RBT would describe factually what the crisis intervention steps looked like and how they implemented them. Informed lead of incident and completed the incident report. Emailed report to lead to be forwarded to, and the RBT would put in the company's name they work for, within how many hours of the incident. Every state or country has a different amount of mandated hours. Please refer to your company for that information. An example of an incorrect session note that includes mentalistic descriptions. Client was so mad today he hit me numerous times. He was feeling intimidated by the mom's friend who came over to visit. I think he needs more time to calm down than 10 seconds. It doesn't seem to work for him. Tomorrow, we'll try again. New topic. Chapter 6. Documentation and reporting. Module. Identify methods to effectively communicate with supervisor. The supervisor should be the main point of contact for all clinical matters regarding clients of RBTs. The supervisor has the most thorough perspective of ABA knowledge and is responsible for maintaining and/or improving RBT's skill level. To ensure effective communication and responsiveness, diligent responses are required to supervisor inquiries. The RBT must possess strong written and oral communication skills to be able to accurately and appropriately communicate with the supervisor via email, telephone, on paper, or in person. The RBT must always use factual, observable language. Avoid subjective, mentalistic terms. Self-reflection after communication with the supervisor is recommended as a best practice for a behavior analyst. The supervision received from the supervisor to the RBT will be regarding the RBT's performance. Research has shown that frequent feedback can improve motivation, learning, and performance. It will also comply with BACB requirements for RBT supervision in frequency, at least monthly, and equal to 5% of total direct hours performed that month. Supervision feedback will be individualized, as immediate as possible, descriptive, paired with positive reinforcement, and presented graphically if possible, and matter-of-factly. RBTs also have great opportunities during supervision to take advantage of any behavior analysis literature related to their feedback received from the supervisor. RBTs as supervisees need to accurately describe their current skill set to the supervisor. There is an underlying assumption in the BACB guidelines that the goal is not for supervisees to fail. The guidelines direct supervisees, in this case RBTs as supervisees, to gain skills and improve confidence in the use of behavioral procedures.